It's the Thursday Morning House Call with Dr. Lane Aiena. Brought to you by Huntsville Memorial Hospital.
Hey, good morning, everyone. Big Glenn here with you in studio with me, Dr. Lane Aiena. Good morning, Dr. Lane.
Good morning. How you doing today?
Pretty good, pretty good. It's a Friday Eve.
It is. It's might be a little rainy this weekend, it's looking like. But, if there's breaks in the rain, the temperature won't be too bad. Maybe still get some good outside time.
Exactly.
It's March.
Yes, it is. And that means it's a very special month medically.
Yes. So this is a really important one to me because it is the second leading cause of cancer death in the U.S. So colon cancer, second highest rate of death in the U.S. and one of the most preventable. I mean, you want to talk about something we can screen for. This is a big one. And we talk a lot about on the show about how early detection is key. I'm usually thinking about mammograms and colonoscopies when I say that because those are the ones that we are really, really good at detecting. So when you're thinking about a colonoscopy, when is it time? We always say 50. The guidelines have moved down to 45, but insurance is still catching up. So at the end of the day, unfortunately, it's what is going to get paid for. That's the system we're in. If your insurance will cover it at 45, that would be great. If they will cover it at 50, get it as a 50th birthday present for yourself. And folks, I tell my patients this all the time. I've said it on air, so that I'm on record. On my 45th birthday, you can ask me if my colonoscopy is scheduled. And I guarantee you, I will have texted the two local surgeons and said, whoever texts back first has to do my colonoscopy because I don't want to play favorites. So I fully plan on getting one. You'd be hard pressed to find a physician that doesn't get screened for this because unfortunately we see what happens when you don't screen for it. If we catch it early, small polyp, it may even be precancerous. They snip it, you're good. I mean, that's that. You know what I mean? They're generally every 10 years. If they do find polyps, they may move it up to every 5. And then if you've got some kind of significant family history, they may make it even more frequent, 1 to 3 years. If you do have significant colon cancer history, say a first-degree relative has had colon cancer, you really need to consider getting it earlier. The rule of thumb is 10 years before that family member was diagnosed. So if your dad had colon cancer at 47, diagnosed at 47, of course, you want to start at 37. That's going to be up to you and your doctor. It's enough for you to know that if you have a colon cancer family history, you need to talk to your physician about it. They'll know what to do. They'll know where to get you. What are some symptoms that may be happening? Well, change in bowel habits. Blood in the stool is a big one. Now, this is not to make you paranoid. Every time you have a change in bowel habits, I don't want you getting, freaked out. But blood in the stool is a big one. Unexplained iron deficiency anemia. Unexplained weight loss. Constant new abdominal pain. These are all things that you need to go to your doctor for anyway. Like, I want you to go regardless of what you think it might be. But those are things to think about. But here's the thing, folks, and this is the key takeaway from this, because all the time I hear, but I'm not having any symptoms. Good. This is the time to get it. If you have early detection of early colon cancer, it is asymptomatic. It is not causing symptoms yet. That is when I want to catch it because that is when it is the easiest to treat, it is the easiest to get rid of, and the easiest to let you go about your life unscathed afterwards. So just because you don't have symptoms does not mean you don't need to get it. As a matter of fact, fantastic, now's the time. It's the total opposite of what you may think. So go talk to your physician about these colorectal screenings. They're very, very important. Insurance will cover it. Insurance by law has to cover screening modalities. Now, I do have to say I don't speak on behalf of insurance, and they are not always rule followers, but they should cover screening modalities. Folks, don't worry about the prep. The prep has gotten much easier. It is a safe procedure. They knock you out for it. You're in, you're out. It's no big deal. There's also the Cologuard. I'd be remiss not to mention the Cologuard. It's a really good screening test as well. I recommend colonoscopy. Obviously, direct visualization is going to be the better test, but the best colon cancer screening is the one you're willing to do. And Cologuard's getting better and better. That's every 3 years. I think it's something like 96% sensitive now on their new one. Don't quote me on that, but I just looked at the data not too long ago. So folks, Cologuard, colonoscopy, pick one of them. Do something, get screened for colon cancer, and catch it early. That's the name of the game.
What great advice, Dr. Lane Aiena. Go get your colonoscopy.
Absolutely.
All right, well, that is this week's edition of the Thursday Morning House Call, brought to you by Huntsville Memorial Hospital.
Let's keep Huntsville healthy.